I'm going to talk about some of the large differences in risk associations and tumor characteristics that we've seen between screen-detected and interval breast cancers in the Million Women study. Yeah, there we go. So among the 1.3 million women in the Million Women study, we see approximately 26,000 screen-detected invasive cancers and about 16,000 interval cancers. And I just want to take a moment to tell you how we define whether or not a cancer is screen-detected or an interval cancer. So the screening round starts, time zero, if you will, at the batch date. And the batch date is the date at which the coordinating center sends to the screening center a batch of names of the women who are due to be invited for screening. Approximately 2 months later, on average, the woman will have her screen. And then after about 3 years, the screening round will end with the next batch date. Now, in the Million Women study, we have information on the batch dates for almost all of the women. We know whether or not they have completed their screen, but we don't necessarily know when the screening date was. So we have defined a invasive breast cancer, a screen-detected invasive breast cancer as a cancer that has occurred in a woman who has completed screening within the 9 months from her batch date. Now, assuming that women who've had a cancer shortly after their batch date don't show up for a necessary screen, we're essentially capturing cancers that occur, say here, in this period here, from the screen until 9 months after the batch date. And interval cancers are defined as cancers that occur 9 months to the next subsequent batch date, approximately 3 years later. Now, for some women in the Million Women study, we have information from the cancer registries about whether or not that cancer is screen-detected or interval cancer. And when we compare that information with our definition, we find excellent agreement. So we can be confident that we are capturing the vast majority of screen-detected cancers. Okay, so what I want to talk to you now is about the significant differences in risk associations that we see between screen-detected and interval cancers. And the biggest differences that we see are for hormone replacement therapy use, body mass index, and prior breast surgery. And the relative risks for screen-detected cancers are on the left-hand side, the left-hand plot, and for interval cancers, it's on the right-hand side. So if we look at screen-detected cancers and HRT use, past users, there isn't any evidence of any greater risk of a screen-detected cancer when we compare them to never users. But current users are about 1.3 times the risk of having a screen-detected cancer. However, if we look at interval cancers, we can see that past users are about 1.2 times the risk, and current users are about twice the risk of never users of having an interval cancer. So why is it that we see this bigger increase in risk for interval cancers than screen-detected cancers? Well, the answer probably lies in breast density. We know that women who use HRT are more likely to have dense breasts. We also know that it is more difficult to detect a cancer using mammography in women who have dense breasts. Therefore, HRT users are more likely to have a false negative result at screening and go on to have their cancer detected symptomatically in the interval between screens. And now, because we see this large difference with HRT use, the rest of the results I'm going to present today will be for women who are postmenopausal who have never used HRT. Okay, so now let's look at body mass index. We can see that for both screen-detected and interval cancers, that the risk of having cancer increases with increasing BMI, but that increase is much greater for screen-detected cancers. And again, this can be explained by breast density. We know that larger women have less dense breasts, and therefore it's easier to detect their cancer at screening by mammography. And now, prior breast surgery, and I should stress that this is not for cancer, we can see that women who have had prior breast surgery are at 1.4 times the risk of having an interval cancer and about twice the risk of having, a screen-detected cancer, and about twice the risk of having an interval cancer. And again, this can be due to hampering in detection at mammography. Because women who've had a prior breast surgery are going to have some scar tissue in their breast, which makes it harder to detect the cancer using mammography. Okay, and in this slide, we're comparing tumor characteristics of breast cancers in interval to screen-detected cancers. And we can see that interval cancers tend to be larger. Their interval cancers are 3 times as likely to be sized between 2 to 4.9 centimeters than screen-detected cancers, and 6 times as likely to have a size of 5 or more centimeters. We can also see that they're approximately 3 times more likely to be node positive than interval cancers, screen-detected cancers, sorry, and that they have a higher grade. So interval cancers are twice as likely to have a grade of 2 and 5 times as likely to have a grade of 3 or more. So interval cancers are more aggressive cancers. Now, given this relationship that we're seeing with grade, and given what I believe Jill Reeves talked about this morning, that if you have a high-grade cancer, it's much more likely to be ER negative, it's not surprising that we're seeing that interval cancers are 3 times as likely to be ER negative than screen-detected cancers. And this is very important. It's a very large difference. And if we flip that statistic around, what it's telling us is that screen-detected cancers are 3 times as likely to be ER positive. And as Rosie Bradley will be telling you in the next talk, the biggest innovations in the treatment of cancer in the last 20 years have been in ER-positive disease. So in conclusion, the differences between screen-detected and interval cancers with hormone replacement therapy, body mass index, and prior breast surgery are consistent with breast density and scar tissue, hampering detection of cancers by mammography. Interval cancers tend to be more aggressive cancers. And finally, screen-detected cancers are 3 times more likely to be ER positive than interval cancers.